not just in this pandemic, as I was mentioning before, but as our lives have become increasingly mobile, people have been moving, all over the country, away, all over the world, away from friends or family. And we have become more fragmented as a society and less involved as a community. And what loneliness is not. Sometimes we confuse being alone with being lonely. Spending time on your own, engaging in hobbies and leisure can be really fulfilling and a great, way to do self-care. It's really only a concern if you do things on your own and you do feel disconnected from others. While some people, feel the need to be around others most of the time, some people need solitary time to recharge those batteries and clear their heads. That's the difference between being an introvert and an extrovert. And some people are those extroverted people. They enjoy large social circles and big families, while others want those smaller groups and one on one interactions. I'm definitely someone, Friday night, I want to be home in my comfy clothes, watching a movie, just relaxing. And I happen to have a husband who likes to be kind of out and about. Not nowadays, but usually that's what he likes to do on the weekends. And there's been a lot of compromises in our marriage over 25 years to make that work. I don't feel lonely when I'm home on a Friday night watching my movie. I'm happy at that point. So people have different ways of being and different ways of recharging. And so it really is a self perception if you feel disconnected to others. Now, the statistics on loneliness reveal it's a very widespread experience. If we feel lonely, we're definitely not alone in that feeling. According to the former Surgeon General Vivek Murthy, in the last 50 years, the rates of loneliness have doubled. And in a 2018 study by Cigna, 2 out of 5 Americans felt isolated and believe their relationships are not meaningful. And this can be attributed to some, trends in society. 25% of us live alone, and fewer than half the population is married, and the number of children per household has declined. This has resulted in 1/3 of adults over the age of 45 reporting as feeling lonely. And those feelings aren't isolated to people living alone or people who are unmarried. 30% of married couples live in conflicted relationships and experience some feelings of loneliness. In older adults, 25% are considered to be socially isolated, and 20 to 30% experience feeling loneliness. So, definitely very widespread. And so, moving on, talking a little bit about sort of the opposite of that loneliness, social connectedness. The term social connection refers to a person's positively experienced social relationships. It's an important aspect of their life. The feeling that you belong to a group and you feel close to other people. A range of social ties from loose acquaintances to lifelong partners. Each of these ties add to your life in some way. Each of these have strong ties or weak ties, a potential to help, and each can be enjoyed. And what are the different types of connections? There are some different ways of looking at it. One model refers to the stages of friendship. We have acquaintances, people we see on a regular basis, but we don't necessarily have a deeper connection. That neighbor that you wave to when you walk the dog, a bank teller, a grocery clerk. We have those casual friends who have shared activities. We cross paths with them, but maybe wouldn't necessarily see them unless we had our kids' soccer games or a class at church together. And then we have that level of close friends, casual friends with whom you start to feel that connection. You share a bit more about yourself and deepen that relationship. And these are the ones that turn into the friends that you can call at 2 o'clock in the morning and they wouldn't be mad. And then we have those intimate friends. It can be a partner, it can be a best friend, the people that you trust with your deepest secrets. And they'll never let you down. They're your kind of ride or die. And Aristotle also had a model of friendship. He describes friendships as utility, others we rely on, and who can rely on us to help on those small tasks. Like those relationships might last as long as the need is there, house sitting or carpooling. And then there's a pleasure type of relationship that exists to enjoy each other's company and have a good time together. Book club friends, watching football, neighbors you can hang out with. These friendships are not demanding and can last from a little while to a lifetime. and it endures as long as it is pleasant for both parties. And then we've got good friendships that's based on mutual respect. It may start out as a proximity to common interests, but a meeting of the minds develops into a deeper type of friendship. You value that person for their true self, and that trust really exists between you. Those friendships really tend to endure, and these are the friends you can go without talking to for a year, and then you pick up the phone and you reconnect and connect right back where you left off. So we're going to move into a little bit more of the health risks of loneliness. Sometimes when we talk about these concepts, it's hard to think of them in a concrete way. And so I introduced some of this research and some of these numbers to really help demonstrate how real it is, this feeling of loneliness, and how it can absolutely affect your life. Being lonely can increase a person's risk of premature death from all causes, possibly as much as the risk of smoking, obesity, and physical inactivity. Loneliness is associated with about 50% increased risk of dementia, and also a 29% increased risk of heart disease and risk of stroke as well. It's also associated with higher rates of anxiety, depression, and suicide. And amongst heart failure patients, loneliness is associated with a 68% increase in hospitalization and a 57% increase in emergency department visits. So it's real. People feeling lonely can absolutely affect, all different areas of your health. Your body can perceive loneliness as another form of a threat, triggering that fight or flight response. This wreaks havoc on the immune system and makes you more susceptible to both illness and chronic health conditions. Having strong social relationships is as important to cardiovascular health as classic protective factors, such as controlling blood pressure and cholesterol levels and maintaining a normal weight. Research shows that living with loneliness can increase our odds of dying more than living with obesity, excessive drinking, or air pollution. And so, what are the health benefits of feeling more connected to other people? People who feel socially connected are 50% less likely to die in a given period than those who are isolated. And, you know, there are a lot of different studies that show connection can absolutely mitigate other risk areas in your life, that you have a lower percent of dying from heart disease, ulcers, or other chronic conditions if you have grown up in a supportive environment where you felt connected to people. And strong family ties are shown to be protective to health to age 50 and beyond. So social connection can absolutely reverse some of those lifestyle factors as well, when they all play together in your body. Social support can improve self esteem and autonomy and enables us to be more confident in solving problems and making decisions independently. Supportive relationships impact our biochemistry, affecting hormones and immune function positively. And relationships can also affect health by influencing your mood, your motivation, your coping skills. Friends and family members can also influence a person's health related behaviors, such as eating and exercise habits. There can be these long term effects for physical and psychological health. And social connections impact mood, motivation, coping skills, all connected into that long term. And so here's the question of the day. We're feeling lonely. We're living in a pandemic. How do we decrease these feelings of loneliness? And, I just want to mention we're going to be talking about some different ideas here. And I understand that not all of them are definitely positive right now, but it really is a matter of thinking about how can we adapt what we have at our disposal to still find those connections in the moment that we are living in. And then hopefully those connections will still be there when things get back to normal and we can go out and about and do our activities as usual. So in our lifetimes, we have natural opportunities to make friends. We're in school, we're involved in sports and the arts and clubs as a child, and friendships, they just come easily. And then we learn a trade or go to college where we meet others who have like interests to ours. We might start a career and our work life and meet peers, and we might date and form a partnership. We might have children and meet others around those shared activities. But later on in life, maybe we were someone that didn't marry or didn't have children, or a partnership ended. Those children we had maybe grown and living their own lives now. And we might be further along in our careers and only around people that we've known for a really long time, not meeting a lot of new people. We might be retired or planning to retire, and natural opportunities to meet others might arise less often. And our existing relationships might be harder to maintain due to distance or even loss. So we have to put a little bit more effort into it. So, how can we figure out how to ease that loneliness? Being at familiar face, that familiarity breeds attraction. Having a routine with places to go where you see the same people increases that social connection and eases loneliness. Research shows that even same gender strangers who interact liked each other more with each interaction. So simple things like an exchange with a grocery store clerk, or waving to a neighbor while on a walk, or asking the delivery person how their day is going to help us feel more connected to others. So even, wearing a mask around, making eye contact with someone can really still have that effect of connection. And there are times when our ability to get out and about is limited, like now. Technology can definitely help us ease that loneliness in many ways. Setting up a family Zoom meeting or figuring out a way, thinking outside of that box. My dad lives in a nursing home that's just a few miles from my house, and I haven't been able to see him in person in 6 weeks. They had a lot of cases of COVID, and it's been really hard because I miss him. And so what I've decided to do is over the last few weeks, I bring him a cappuccino, which he loves, and then I walk around to his room and I watch him drink his cappuccino while I am out the window. And even when it's really cold, I stay 5 or 10 minutes, but I feel like I've made a connection with him. And so sometimes you just have to kind of think of different ways that you can still get those same feelings, those same benefits, even though we're in a limited situation here. Taking advantage of interest groups and community groups that have moved online these days. All kinds of groups are meeting online, including book clubs, online group exercise classes, support groups, even online choir, and sharing those moments. Another study that we reviewed, gradually increasing the depth of questions and answers causes strangers to develop a friendship in just 45 minutes. If you have some casual friendships, you can evaluate them and see if you want to form a closer relationship with someone, giving that person a phone call or a FaceTime call and just spending even 15, 20 minutes catching up on each other's lives. Some of these things, it does take effort on our part to step outside of our comfort zone and be intentional about creating those experiences. And then you can also reassess, are you really feeling lonely? This can be a very subjective experience that can be a self fulfilling prophecy, increasing that isolation that you feel. Taking an inventory of your family, your friends, your acquaintances, and think about the times that you have connected with others. Are you lonely in a crowd? Might you be content on your own? You might decide you just aren't as lonely as you thought. And if you are, you can definitely try to do something about it. And so some other things to think about, online sometimes is what I call that. Yes, we are using technology. It has been a lifeline to so many of us during this time that we've lived in. But also there can be some, drawbacks. Some social media time can be great. You're keeping up and engaging with people that you might not necessarily have kept in touch with. But as long as you're not using those social media platforms so much that it induces this fear of missing out, or it increases your isolation, or you're finding yourself comparing yourself to others, which can lead to those feelings of inadequacy. We all have to remember when we compare ourselves to others, we're not seeing the whole story, right? We are seeing this carefully cultivated persona that's been created on a Facebook or an Instagram. And that you see all of the shiny things, but maybe not the true situation of what's happening in other people's lives. And then we find ourselves comparing that. Wow, how is their house so clean? Why do their kids behave so well? And then we start, feeling bad about ourselves. So definitely lots of positives, but connecting individually, not necessarily on those social media platforms all the time, can be a very nice thing to do. You know, video chatting still with distance with that one or two friends that you really enjoy. You're looking into their eyes, even if it's through video. And that technology that we have should definitely supplement, not take the place of those existing relationships that we have. And, you know, trying to make it natural, making sure you really want to cultivate more connections. There's no need to force it if you're fine with your time alone. If you do want to meet others, you know, finding that activity or interest that you can share with others. Being open to variety. Some people need a wide social circle. Others just find that one to two friends, close friends, are enough for them. So really be thoughtful about that and think about what is right for you. Sometimes it doesn't have to be just all about friendship. Social connections can help even at just the acquaintance level. And talking again, sharing a gaze with that acquaintance, meeting that eye contact can produce self other merging, which creates a mini community. And so, even gazing at a stranger, making that eye contact, smiling through our mask at somebody, saying hello, good morning, those are all connections that are, if you are feeling disconnected, lonely, you might feel a little bit better throughout the day, making those connections with people. So, how to keep increasing those social connections? Finding a group, you know, a support group. Do you have a challenge? Finding a group that's focused on that challenge can really provide information, insight, camaraderie, and maybe even some friendships. Characteristics of a healthy group include members who are going through similar issues. There's an expectation of give and take, and leadership comes within the group. No one monopolizes all of the time. And there are small or no fees. This can be both in person or online. And then we've got interest groups. Do you have hobbies or activities that you like? Are you a hiker, a book reader, a knitter, or an amateur chef? You can find a group that does almost anything. You know, checking online or looking for opportunities in your area. You might find a flyer for a group that's just a perfect fit for you. And then we have faith groups. Do you have a religious or spiritual beliefs? Finding a group that shares your beliefs can be enriching. Being in a group that makes you feel belonging to something bigger than yourself fosters that social connectedness. And then volunteering. Everybody has something to give. You can tutor adults for literacy, stock up on a food bank, rock premature babies in the NICU, or paint the house of elderly neighbors. The local United Way has a clearinghouse for volunteer opportunities, which is a great way to connect with your community as well as foster those benefits of altruism. And participation in those groups can provide those three essentials of human happiness: purpose, structure, and connection. If you find all three of those in a group, your well being will increase. And expanding your reach. Many people don't feel like they have access to social support. Here are some strategies to think about finding that. Casting a wide net. One person doesn't have to be all things to you. Talk about work with a colleague or brainstorm about your kids with a neighbor. Call your faraway friend for a laugh. Spread it out a little bit. And being proactive. Sometimes we wait for that phone call. You can extend that invitation, offer some help, strike up a conversation. That other person might be very grateful that you did. And again, back to technology. Sometimes we can't be near those ones that are dear to us, and reaching out in different ways that are available for us today. A lengthy email is pretty much like getting an old fashioned letter these days. And having that video chat with the grandkids, texting funny memes to your old fraternity brother, you can follow your interests. It's worth stating again, interesting people do interesting things and make for interesting friends. So when you share an interest, that connection can really be formed naturally. And improving your social skills. I talk to a lot of people who will say, I just can't take that first step. I'm really shy. It's hard for me to get out of my comfort zone. So really trying to brush up on those skills if you feel a little bit awkward of starting conversations or keeping conversations up. Asking simple, genuine questions, something that you're curious about, is a great way to start a conversation. Asking others about themselves. You know, people usually truly enjoy genuine interest in them. And if striking up a conversation or seeking relationships feels intimidating, Consider connecting with a therapist who might be able to help you with those social skills or confidence and build you to the point where you feel comfortable being able to reach out to others. And asking for help. If you need help with something, there are many community groups who provide it and can help you connect with others. And something that we absolutely shouldn't forget, nature. You might not think you can foster connectedness in nature, but you would be wrong. Well being is positively associated with both social connectedness and contact with natural environments. While nature absolutely doesn't replace people, it can be very much an adjunct to feeling connected. Feeling connected is something bigger than yourself. A recent study showed that high levels of exposure to nature mitigates the negative impact of that lack of social connectedness. Nature can play a big role in offering socially isolated people a way to feel connected. So don't forget about nature. Well, that kind of brings us to the end of my prepared comments for today, but I'm definitely available. I'm very excited to answer any questions that you might have. We have a Q&A section that if you have a question for me, you can put your question in there. You can do it anonymously if you'd like, and I can see it typed in here and I'd be able to answer it. So let's see here. I don't think I've got any coming through yet. Let me just check the chat real quick. Oh, too bad. Sorry, it sounds like my volume. So the question is, I think I might be depressed. Is that the same as loneliness? So that's a really great question. And no, it's not. Depression is definitely a clinical diagnosis related to different symptoms that you might be feeling, lack of energy, increased sleep. Some of those might look similar to loneliness, but depression is definitely a very different thing. If you're having trouble engaging in your daily life, like making it to work, or you don't feel like connecting with others, yet you feel lonely, you want to connect, but you don't feel like connecting, it might definitely be worth it. Talk to your doctor. Many companies have employee assistance programs where you can speak to a counselor. You can also call your 1-800 number on the back of your medical card and ask about mental health services in that way. But yeah, depression can be a pretty serious thing. So it's a good thing to get some help around that. Oh yeah, you're very welcome. So how do you go about feeling a therapist you feel comfortable with? Great question. That's a hard one too. Sometimes it's not that easy to just kind of bring up like, hey, who do you see as a therapist? Sometimes our society doesn't talk so openly about that. Many times your doctor's office has a referral list of therapists that they've worked with and they feel comfortable referring people. You can also use, there are many online, American Psychological Association has a directory where you put in your information of like your zip code and it will pull up therapists in private practice. They might have a little blurb about them and sort of what psychological theories they might use and that kind of thing. Probably the best place to start is if you have private insurance, is get a list of the therapists who are covered under your plan. And if you can't like find information about them from friends or family or your doctor, just start calling and try to get on the phone for 3-5 minutes and just say, here's the situation I'm dealing with. Is this something you have experience with? And ask them what kinds of things they do as far as their sessions go. And even in that 3 to 5 minutes, you can kind of get a hit on that person if it might be a good fit or not. So I always recommend for people to shop around. And if you do one session and you just don't think it's a great connection, that's totally okay. Believe me, that licensed therapist is not going to feel bad if you don't come back. We know as therapists that there are good fits and there are not so good fits. So it's okay to kind of give it some time and try to find one who really is a good fit for you. Retired husband who does not want to socialize and grouchy many times. Yeah, that can be, I know a lot of couples like that for sure. And unfortunately, with our spouses or our partners, we can't be in control of what they're willing to do or not do. So if you find yourself in a situation where, yeah, you are lonely and you want more connection with friends or activities, but your partner's not willing to engage in those, you can work to come to some sort of compromise, but on some level, you might have to just say, you know what, this week I'm going to go, play bridge with my friends. What do you want the plan to be for dinner, etc. And then you're both doing your own thing. That's okay. And I think many times, I know for my husband and I have been married 25 years, there are definitely things that we don't enjoy together, or I'm usually the one that wants to stay home and he wants to go out, but it's okay. If you're finding that, that's happening all the time, then that might be something where you guys might need to have a larger conversation about that for sure. But many times someone else related to us in that connection doesn't want the same things that we want, and that's okay too. You can do what you need to get fulfilled for sure. I have a lot of toxic friends. How do I make friends that add to my life and not take away from it? Yeah, great question. Toxic friends are difficult. That's probably the opposite of wanting to make that social connectedness. So you really have to be aware. And when you find that you don't enjoy spending time with someone, or you don't look forward to the events that you had planned together, you don't have to make a big deal out of it. You don't have to have a big, have it out with the person, but you can slowly, communicate less and less with them. Finding new friends, again, as we kind of covered in the presentation, there's different ways. You have to kind of put yourself out there, which can be hard for sure. But just seeing people that you have connections with and then engaging with those people, but really having good boundaries for yourself. Like, you don't need to be in a toxic relationship. I was having this conversation with my 20-year-old daughter the other day, and it's like, you don't have time for that. You can just move on from that one. There's a lot of other people to be friends with, and that's okay. You have to do what's right for you. um yeah, I have heard of mental health first aid. I actually took the training too. Yeah, it really is a great presentation. Someone was talking about mental health first aid, which they go around to communities and give presentations and talk about how to engage with people who might be in a crisis type of situation. And you're right, the world that we live in right now, mental health, being able to say, like, I'm not okay right now, or it's okay to not be okay. Let's figure out how to get some help. Let's figure out how to get resources. I just love that we're talking more about all of these things, and it's becoming less and less stigmatized in our communities. We actually have the Colts here in Indianapolis, and there's a great commercial on right now with the CEO of the organization and several of the players talking about some mental health struggles that they've had. And what an amazing thing to have these role models talking openly and honestly about it. I find it hard engaging with friends that were close and intimate, but now we're casual acquaintances. How can I change that if I'm the one always reaching out? Yeah, no, that's a really good point. And sometimes we do have to kind of sit back and ask ourselves, is this a relationship that is both ways? And if it's not, sometimes we do have to let go of that. And it could be that there could be another friendship that's more fulfilling to you. And I also have, I think once you have these friendships that have happened in your lives. And I had people that I was very, very close with when my kids were really little. And now that our kids have kind of grown, we don't have that same bond. And I think instead of trying to fight for something that maybe isn't there anymore, sometimes you do have to make that decision to let go of it. And that is a process, and you're the only one that knows the right answer for you in those relationships. So I'm very shy and definitely an introvert. I like being by myself, but I really have trouble putting myself out there. What kinds of suggestions do you have for me? Um, I totally understand what you're saying. It's actually sort of funny because I tell people I'm an introvert, which I think is funny because I like to talk a lot and chat with people, but being someone who it comes naturally to or wants to be around others is kind of a personality thing. And And that's okay. If you feel like you do want to make connections, it really is a matter of practice and putting yourself in small experiences where you are reaching out. Maybe you're in classes, or maybe you're in some sort of church group or something like that. And, phoning someone and saying, hey, I noticed you were on this class too. What's going on with you? Do you want to chat for a little bit? So it is putting yourself out there, which can be hard, but being very intentional about it and just practicing. You can role play, with someone you feel super comfortable with to try to get more confidence about it. But if it really is something where you feel like you might have something more deep, like a social anxiety or something like that, again, that's a great thing that you can get help with through therapy, and practicing and learning how you can create those skills. It might be something that just doesn't come naturally to you, and you need to be very like intentional about developing those skills. Let's see. So I have heard of apps where you can access a therapist with a behavioral coach to help you with an issue for set periods of time. Seems less threatening and offered through some group carriers and employers. Yeah, absolutely. I've heard of those as well. I am a telemental health provider, and so I've been certified in those specialized kind of issues of being able to provide therapy long distance. And so there are many, obviously, it's just growing like gangbusters right now. So, doing some research, many insurance companies are also covering those kinds of resources now in the pandemic as well, to be able to do that kind of distance counseling. So, it's absolutely redefined the industry of counseling for sure. And I think in a good way. I mean, like a very depressed person might have difficulty getting themselves up, getting themselves ready, and getting in a car to go to a therapist's office. That can be too much for some people. And so the ease, the convenience, it really does help people access the services, which is absolutely what we want. So, yeah, I've definitely heard good things. It is becoming a more regulated industry. So that's something to really, make sure is this therapist licensed, this mental health person that you're seeing, are they licensed? Do they have a certification? Those are the kinds of things to make sure you're engaging with a reputable company and things like that. So, what are your thoughts about social media towards social connectedness? Does it hurt or does it help? That's a great question. I think it does both. I think you have to be very, very aware that you are seeing a small corner of my room, but you're not seeing the rest of what my life is out there. And when we have these very special curated pictures on social media, and you have these influencers where it's their whole job to basically post things, it's just important to keep perspective. It is a great way to connect with people that we wouldn't necessarily have connections with. So I do think there's positives and negatives. It's a really, really, really important thing to keep an eye on with kids, teenagers, young adults, and talk about, what do you think about what that girl commented? What do you think about, this picture that this person just posted? And really trying to help them navigate. I think that sometimes when you're young, you don't have that perspective that people who are older might have. So that 14-year-old is just seeing all of these super pretty people on social media. They don't understand that they were 14 at one point, and they might have been similar. So it can affect your self-esteem a lot. It can affect your self-view. So being very careful about it and just making sure you have the correct perspective is really important. Okay, let me see if I've gotten all of these. Um, okay. Yeah, I think I've gotten most of the questions here, unless there were any more coming through. Yep, I think we've hit them all. Well, thank you again, everybody. Oh, are there certain triggers or keywords to watch for to determine if someone is lonely or depressed? Yeah, that's a really, really great question. I would say that really just the things that they might say, where they might say, I feel so alone. They might say, I don't have any friends. I don't feel connected to anyone. I wish I had someone to go to dinner with tonight. I wish I had someone who could, engage in this craft with me. So when they're the difference of someone who's alone and happy being alone versus that person who's feeling not connected and lonely is their desire, their perspective on it. So if you're hearing someone, I would love to do that. I just don't have anybody to do that with. I wish I had more friends. I don't know how to make friends. I feel so alone. Those are the kinds of things that you would want to definitely listen for. And then have that conversation of talking to that person of what are some ways that you might be able to feel less lonely? What would make you feel more connected to someone? What could you possibly do to be able to do those things? And some of the ideas that we had in the presentation today. But yeah, I think really listening and hearing what their perspective is of how they're feeling is really important. Great questions, everybody. All right.
Thank you so much, Anita. I think that this was excellent. A lot of good questions. I just wanted to bring up, I think there was one question that was missed.
Okay.
Someone had asked, how is the pandemic affecting our children with feelings of loneliness overall? Any statistics?
Oh, so yeah, off the top of my head, I don't have statistics, but I do. I mean, just myself listening to my own kids. Um, I think it is really, really important, even younger ages of kids, to help them foster ways that they can feel connected. Whether they're a school age kid, can they have a pen pal with their friend at school that they don't get to see outside of school right now? Can you set up, a FaceTime call with your 3-year-old and their best cousin that lives a state away? So continuing to try to foster those kinds of connections that we as adults want, even if they're in just very small increments, 3 minutes, 5 minutes, but just, I talked to my friend today, it can really make someone just feel better and more fulfilled. And then, yes, during the pandemic, I've got these teenage girls and trying to figure out ways that are safe for them to feel connected with their friends. You have to have kind of your own opinions and perspectives about that. But being able to sit outside in cars in a parking lot and eat dinner in separate cars is what my daughter did last week with a couple of her friends. So there's definitely sort of, if there's a will, there's a way, and you have to have the conversation. What's comfortable for your family? What's comfortable for maybe the friend's family? But fostering those small ways for them to continue to feel connected is really important.
Great. Thank you so much. And thank you everyone for your questions. That was a really good interactive part at the end. And this information is so important at this time, all the time, but especially now. And it's just shocking how much loneliness can affect your health. So thank you again, Anita. We really appreciate you joining us and all the information that you shared with us. And hopefully, we can move forward and apply that during this time. So we appreciate you being on with us. If this is your first week with us, I'm Julia Wilkins from Health New England. I'm on the health management team. Thank you so much for joining us. So as Melissa had said at the beginning, you will receive a follow-up email from Kathleen Bruno, that has the YouTube link as well as a survey link. I'm going to post that in the chat now. Again, I had posted it the first time I posted it. It had a period in the link, so don't use that one. It won't work, but I posted it twice and just now to please help us out by taking that post survey. Let us know how we're doing. And that will also be in the follow-up email. We hope to see you again in another 2 weeks when we have our next session. That's February 10th. And we're going to talk about why healthy habits matter. So that's going to include how to create positive behavior change that improves sleep, which I know I need, limits stress eating, and reduces stress overall. So continue to share this webinar series with all the new friends and connections that you make after what you learned today. And we look forward to seeing you in 2 weeks. Thank you again, Anita, and everyone have a great week.
Thanks.